social care sector is in danger of collapse without an immediate cash injection of £7 billion a year. We're joined now by Jeremy Hunt, the chair of the Health and Social Care Committee, who's urgently calling for this extra funding. Good morning to you. Thanks very much for joining us this morning. It's clear this money is very much needed. It is a difficult time to be asking for more money, though, isn't it, with all the pressures that we've got going on at the moment. We know that national debt's hit a record £2 trillion at the moment. What will happen if the social care sector doesn't get this money that it needs?
Well, morning, Kate, morning, Charlotte. I mean, we will have a catastrophe. It's as simple as that. And I think it is a difficult time. There's no doubt our national coffers have been cleaned out by the pandemic. But on the other hand, this is the year when the whole country saw how brilliant the care workers were in care homes, putting their own lives on the line, some of them sadly dying because they were looking after residents in care homes in appalling situations. So if we're not going to do it this year, I really don't think we're ever going to do it. And it's been something that governments have been talking about for a long time. I tried to fix it. I got a settlement for the NHS, but I didn't get one for the social care sector. And it really is now or never. And I think this is what the country wants. And I would really strongly urge the Chancellor to bite the bullet on this one.
I wanted to ask you on that because, of course, you were Health Secretary for a number of years and social care has been underfunded now for a long time. Why weren't you able to do something about it when you were in the position to do that?
Well, I did get some significant increases in funding for social care, but what I didn't get was a 10-year plan. And that's what I negotiated for the NHS with Theresa May and Philip Hammond, who was Chancellor then. I think Theresa May was very, very committed to the social care sector, but then events sort of overtook us. And we're now in a situation where the market risks complete collapse because a lot of care homes are going to start saying, we're just not going to take local authority funded residents going forward because they just don't have the money to pay for them properly. And we're going to end up with a fully privatized system where you have very nice care homes, but only for people who are paying top whack. And then everyone else lives in substandard accommodation. And that would be an absolute betrayal of our values as a country.
Sorry, I was just going to say, you did talk about not getting the settlement that you wanted while you were Health Secretary. During the Tory leadership race, you did talk about regret, about some of the cuts that you saw to social care that you felt went too far while you were Health Secretary. Do you feel regret that, in a sense, you were part of the problem then?
Well, look, I was part of the government that brought in some very painful austerity measures. And I do think, overall, it was the right thing to do in 2010 because we got the economy growing. And on the back of that, I was able to negotiate that huge £20 billion increase for the NHS. But I did say that I thought the cuts in social care, looking back, went too far. And I think they are sort of silent cuts. When you cut the social care budget, you don't take away money from anyone, but you stop new people becoming eligible for help. And so no one really notices it, but it does do enormous damage. And I think now is a really big chance. Boris Johnson has said that we can fix this and we will fix it. I think he's absolutely right to say that. It's a big moment to put things right.
It's lovely to see you, Jeremy. It's been a while. It's lovely to see you back on the show. Is part of the problem really that social care is so expensive and no health secretary wants to have the conversation that's needed, which is you're either going to have to pay for this with more tax or you're going to have to pay for it yourself. It's just not an election winner, that conversation, isn't it? And in a way, governments have ducked this, and that's why we're in this mess.
Well, first of all, thank you. It's lovely to be back on the show. Actually, the last time I was on the show was when I was an actual government minister, because I was listening to your intro just now, and it was at the very end of that Conservative leadership contest. You're absolutely right. With social care, it's a very difficult conversation to have because it's more funding from the Treasury, which means more taxes, and everyone's worried that's not popular. But I would just say this. The one tax that we have had on social care in the last 5 years is the new social care precept on the council tax, which allows council taxes to go up by a little bit more to pay for social care. And as an MP, I've had virtually no complaints about that at all. And I think the public do understand that we have an ageing population, we're all going to be old one day, and this is something that they want fixed for themselves because they want to have that security of knowing that if they end up with dementia, needing to go into a care home, they're not going to see their life savings cleaned out and they're not going to see their family security taken away.
And on that note of politicians having to explain to people, I mean, the reason we're particularly pleased to see you this morning is, as you know, we aren't hearing from any government ministers here on Good Morning Britain. It's 177 days now of boycotts, which is, you know, frustrating for us, frustrating for the viewers as well, that we're not able to put questions to the government ministers. So thank you for coming on.
Do you think they should come on?
Yeah, what do you make of this?
Well, of course, I think government ministers should appear on all major media programmes, so I hope you're successful in your campaign.
Thank you, Jeremy. One quick word on care, Mrs. I know it's a social cause what you want to talk about. I'm sure you've seen this morning, it looks likely that it's going to be banned, that care staff can move from home to home. That isn't practical, is it?
Well, actually, I think it's not only practical, it's absolutely essential, and countries like Israel and Canada banned care staff from working in more than one care home a long, long time ago.
But the care homes don't have enough staff, and the workers aren't paid enough money to not be able to make it up around. They're on 0 hours contracts, so that would mean a massive investment today.
Well, if necessary, we need to make that investment. I mean, that's one of the things we're arguing in our report that we published today, that we do need to be better at valuing care home staff. But the reality is that we had a terrible tragedy with the numbers of people who died from COVID in care homes. And one of the reasons was the ease with which that virus came into care homes from the community. And I think we absolutely have to make sure that it's not being carried from care home to care home. So I know it's difficult and maybe there needs to be extra help to care homes to make this happen, but I think it's absolutely essential that we do this. In fact, I wish we'd done it earlier.
And can I ask you something else that a lot of people are talking about this morning? It's MPs rejecting Marcus Rashford's free school meals drive. He'd been pushing for it to be extended into holidays to be able to support those children who are finding it particularly difficult at the moment because of poverty to get the food that they need. What did you make of this? Was it something that you backed?
I voted with the government on this one. I think it's incredibly difficult because everyone has enormous sympathy with what Marcus Rashford is arguing for. I think we have to wait and see where we're at over the Christmas holidays. If we're in a lockdown situation, if families on the breadline need extra help, I think MPs and the Chancellor will be very sympathetic. But we're not quite at that point yet. And I think we're about to hear today the Chancellor is being very generous.
And there'll be many youngsters in half-term in that situation.
We have got half-term, but I think it's also fair to say that this Chancellor has been more generous than pretty much any other government anywhere else in terms of the financial support. So, as I say, I think if we end up in this situation in the Christmas holidays, I'm sure the government will look at it again. It's
difficult, isn't it, though? I mean, Marcus Rashford spoke about it and he said, you know, a significant number of children are going to bed tonight not only hungry, but feeling like they don't matter because of comments that have been made today. And for them, I guess it's hard to feel that they've been ignored by politicians.
I think it's unfair to say that they've been ignored. I mean, the government listened to Marcus Rashford over the summer. I know they're listening to him now. I'm sure they're very sympathetic to the situation for families who are having a very, very tough time. And I think we should wait and see what the Chancellor says today and then take a judgment in the round about the support the government is giving to people and businesses in extreme difficulty.
And Jeremy, have you been personally affected by the pandemic? I don't know. Have you managed to stay safe and stay healthy?
Well, thank you for asking, and particularly from you, because I know what a terrible, terrible time it's been for your family. We've been fine health-wise. I think I've been like mums and dads up and down the country, really struggling with home education, and I have to be honest, my wife has really taken the strain on that, and it was a massive relief when the kids went back in September. And so I think we're all quite happy in the Hunt family that schools seem to be carrying on for now.
Everyone's got a new respect for teachers,
Yeah.
aren't they, after that period?
I think a lot of us are with you on that one, definitely. Jeremy Hunt, thanks very much for joining us this morning. We really appreciate it.